I'm Dr. Clayborne. I'll be taking care of you today.
You can become ill or injured at any time. Do you want a stranger taking care of you? As an ER doctor, I want to know who I'm taking care of when I rush into an emergency. What happens when the majority of patients are in shock, distress, or unable to speak for themselves? And what about now, during COVID-19, when family members can't go into the hospital and paramedics are limited in what they can do before they drop you off? Who speaks for you? Where is your voice? Do you have goals of care? Do you have medical conditions or medications that I need to know about? All of this information is essential to me being able to treat you in the first few minutes. An advanced care plan that you create and that I have access to is the best thing that I can have to allow me to care for you, and more importantly, for you to have a voice in your own care. I want to tell you a story. As I tell you this story, I want you to close your eyes and think of your grandmother or your mother, perhaps an aunt or a sister. This is the story of Mrs. T. She came to the emergency department in March of this year. As she arrived in respiratory distress, the paramedics who brought her in were sweating underneath their PPE as we rushed her into a negative pressure room because her oxygen saturation was dangerously low. I looked at Mrs. T in the bed and I felt sad. She was alone, bedridden, and clearly had been shuffled back and forth between the nursing home and hospital, as evidenced by the old tape marks from prior IVs that were in her arms and scars from central line catheters that had been placed in her neck. She looked emaciated and hollow, her eyes barely open. I could tell that she was tired. I flipped through her paperwork and I found a next of kin listed, a daughter with an out-of-state number who I was unable to reach, and things were rapidly deteriorating. Her forms listed her as a full code, but were dated from over a year ago. With no more time to make a decision, I intubated Mrs. T. I placed a breathing tube down her throat to secure her airway and help her breathe. Her blood pressure dropped, so I drove a large central catheter into her groin to help administer medications. Despite all these measures, Mrs. T's heart stopped. I knew that CPR would be futile in this elderly woman with multiple medical problems, who was likely now dying from COVID-19, but we did our best to resuscitate her. Her ribs snapped under the pressure of chest compressions and made crunching sounds with each motion. Blood started spewing out of her breathing tube as we tried to suction it out. We gave her multiple rounds of medications, and after 12 minutes, we got her back. Well, what was left of her. I fully knew that while Mrs. T's heart was beating, her mind, the thing that made her a human being, was likely irreversibly damaged. Mrs. T coded 2 more times until we were finally unable to bring her back, despite all the fancy medications and tools at our disposal. When I finally called her time of death, I couldn't help but to feel guilty. If she had been my grandmother, I would have been ashamed that in the last hours of her life, she was poked and prodded, exposed and naked, in a room full of strangers who were scared for their own lives as they did high-risk procedures that were unlikely to make a difference in the very end. I knew that we had finally crossed that very fine line from the Hippocratic oath. First, do no harm. I'm all too familiar with patients like Mrs. T. As our bodies begin to age, medicine has evolved to add more and more years to your life. But this does not necessarily mean that they're quality years of life. This can be even more devastating when illness or injury strikes you at a very young age, leaving you completely dependent or very ill. So what's the solution? What can you do with so much fear and uncertainty facing us all? I have an answer that can empower you, that can give you some sense of control and can protect you when you're unable to speak for yourself. You can plan ahead. What I mean by that is that you can make an advanced care plan. One of the most important parts of advanced care planning is making an advance directive. a document that tells doctors like me what to do in an emergency to guide your care. It asks questions like what to do if your heart stops, or if you need assistance breathing, who to talk to in an emergency, and what treatments you would like based on your health condition. It's important when filling out this document that you do the heavy lifting of thinking carefully about this now. What does quality of life mean to you? You have to do this before you get sick, before your family has to make a decision, before an ER doctor has to put her life on the line to save you. What is important to you? Is it important for you to be able to walk outside, perhaps change the channel on a TV, talk to a loved one, feed yourself, or bathe yourself? If you could never do any of these things again, would your priorities change? I want you to think about that now. Contemplate what the implications are for your family, for your body, and for your soul. People with advanced care plans are 3 times more likely to have their wishes followed. Without an advanced care plan, cancer patients are 7 times more likely to undergo mechanical ventilation and 8 times more likely to have attempts of resuscitation at the end of life. Nursing home residents without an advanced care plan have more hospitalizations, are less satisfied with their care, and have 33% higher costs of care. And remember, these decisions are not without a cost to our society. 50% of US healthcare spending treats 5% of the population. A third of Medicare spending is incurred in the last year of life, often on treatments that are unwanted and unnecessary. And despite knowing all of this, fewer than 30% of Americans have an advanced care plan. This year, I personally had to revisit my advanced care plan. I was 7 months pregnant when COVID-19 hit, working in an underserved emergency department outside of Washington, D.C. We're seeing severe cases of the coronavirus rampage communities with long-standing health disparities. I was caring for people who looked just like me, a few years older, or perhaps my parents' age, who were coming in and dying in a matter of days. It was terrifying. At that time, our testing, treatment, and understanding of the virus was just beginning. I wasn't sure what the risk was to my unborn child or my 18-month-old at home. I remember having a conversation with my husband, describing what I should do if I became ill or went into preterm labor. It was important for me to have him understand what my quality of life was, and how to protect that and our baby. I updated my advance directives and asked all of my family to make sure that they had recent forms that we could easily access electronically on a platform like mydirectives.com. I made sure that they understood it wasn't enough just to tell me what they wanted, but to appropriately document and share that with their doctors and families so that it easily could be looked up in an emergency if needed. This is important for people of all ages. Advanced care plans allow you to identify a proxy, somebody you trust who you've told about your wishes and medical conditions, and who's willing to speak for you if there is an emergency and you cannot talk for yourself. This is important and a lifeline for doctors like me who need to access information quickly if there's an urgent situation that needs an immediate response. I also told my family that advanced care planning wasn't something we visit once and never talk about it again. And it's a process, something we should discuss regularly, especially when anyone's health or circumstance has changed. This allows us to all stay on the same page and understand what is most important for that family member. Fortunately, I gave birth to a healthy baby girl in May, and I spent 3 months cocooned at home with my family, watching as the world and the US battled COVID-19 and everything that came with it. When I returned to work, the first thing I noticed is that the same problem still existed. We were still caring for patients not knowing what their wishes were. An advanced care plan not only protects your body and your health care and your values, it also protects the frontline providers who are taking care of you. It protects me from having guilt or anguish from torturing patients at the end of life when I'm not sure that's what they would have wanted. It protects your family from having the immense burden of having to make a quick decision, but not ever really being sure what you would have wanted. It saves millions for our healthcare system from spending on interventions that are often ethically and clinically inappropriate. And it prevents healthcare workers who are putting their lives on the line every day for strangers from exposing themselves when it is unnecessary and unwanted. I often tell families and patients when we're having difficult conversations about dying that I think of DNR as die naturally and with respect. Just because you're telling me that you want to have a natural death doesn't mean that I'm not going to do anything for you. I'm going to treat your pain. I'm going to control your symptoms. I'm going to make sure that you're comfortable. I'm going to respect you as an individual. The best gift I can give to a patient is a good death. And please don't conflate advanced care planning with death panels or doctors playing God. Contrary to popular belief, I have no desire to make these difficult decisions for you. My job is to clearly and honestly communicate what medical interventions are available and what might be right for you based on your health condition. But you have to tell me what's most important to you. And only then can we have shared decision-making that respects you as an individual. I want to know what you want. Where is your voice? And what are your values? For some people, this might mean to do everything. For others, it might mean to focus on symptom management and pain. And perhaps your goals of care align you with something in between. I have another story of a patient who I treated amidst COVID-19. His name was Mr. J. He was 81 years old, and he had 3 sons and 7 grandchildren. He came from assisted living where he had been sick for over a week. When he arrived in the emergency department, his breathing was shallow and quick. He looked scared and he was blinking a lot. He had a written advance directive that stated that he did not want any interventions. I found a number for one of his sons on this document. I called him to tell him what was going on. I explained that their father was very ill and likely dying, and that his advance directive instructed that he wanted palliative care only. I asked the son what their father would say if he was able to speak for himself. Dad never wanted any machines, I was told. He had been very clear with his sons that he had lived a good life, and if the time came, he preferred to not have any interventions or be resuscitated. I knew that this meant that Mr. J was going to die, but instead of feeling guilty or sad, I was relieved. I knew that I could control his symptoms, ease his pain, reduce anxiety. I asked the sons if they wanted to come to the hospital to be with their father. At the time, we were allowing 3 visitors for patients that were near death. They all arrived and were able to come into the room and sit with their father, hold his hand, and be there as he took his last breaths. He was warm, covered, comfortable, and surrounded by family in the very end. He had a good death. Many of us are scared right now. We don't know what the future holds, and there are so many dangerous and unpredictable events taking place all around us. It is in these times that it is most important to sit and reflect on what you value most in life. Appreciate and relish in these things. They are not promised, and they may not be there tomorrow. But for today, you can calm yourself in the storm by making it clear what you want for your body and your soul. This is essential for people of all ages. An emergency can strike at any moment. Make an advanced care plan. Protect yourself, protect your family, and protect me. Thank you.